is Florian Scotté. I'm a medical oncologist at Gustave Roussy Comprehensive Cancer Center in France, Villejuif. It's my pleasure today to discuss with you the major the key points on nutritional treatment and parenteral nutrition, specifically in the scope of pancreatic cancer.
Do you think we are moving in the right direction to address malnutrition in patients with cancer?
Today, the number that we have over the world is that cancer patients are, for about 40% of them, with malnutrition at the start of the disease. And it's probably exactly the same during the disease. It's because we have to discuss together in a multidisciplinary attempt, we have to better manage our patients and probably to better assess our patients.
In France and in other countries, a number of patient pathways have been developed. What is your opinion on how much a patient pathway can improve the care of malnutrition?
As I told you, 40% of our patients have malnutrition. So we have to develop several pathways. We have to develop rules in order to better manage our patients. It's what we have done in France with a rule published in 2016 and describing exactly what we have to do with our patients. The first thing to do is to do a nutritional assessment of our patients. Then we have to give targets in terms of intakes, and we have to define the right product to deliver to prescribe to our patients. So the third point is to assess the way to administer the nutritional products, and we can divide the PICC line use, and we also have the tunneled curve central venous catheter. The PICC line has a good, very good use and very safe use. It has been demonstrated in several publications, and I remember at the ISOO meeting 2 years ago, and we know in a publication presented by published by Paolo Cotogni, over 854 patients with central venous access device, that there was a low rate of infection in the patients with PICC line, and there was about the same level of complication with PICC line. So we can use it very safely. We have to avoid any peripheral use to administer the treatment. In France, we have to start at hospital the nutrition, the parenteral nutrition, with the first prescription for 14 days. Then we need to reassess the situation of the patient at 14 days, and we can reconduct the prescription for 1 to 2-fold the 14 days with the discharge of the patient. Of course, we have to monitor our patients, and we usually have the support of home care management teams in order to monitor the efficacy of the treatment, but also the complications.
Too often, malnutrition is addressed late. What's your suggestion for early adoption of a correct artificial nutrition therapy?
In general, I think that we have first to assess every patient systematically at the start of the disease, at the diagnosis. And if we have the ability to assess our patients in our daily practice, it will be really more easy to better manage them and to have less patients with malnutrition disorders during their cancer disease.
Some physicians are reluctant to use the chemotherapy vascular access device for artificial nutrition. What's your opinion on that?
So just to remind you, the excellent publication of Paolo Cotogni a few years ago, And just to remind that in that study on 854 patients, the results were really interesting. Comparing PICC line news and tunnel curved central venous access device. So I think that in the daily practice we can very easily use the PICC lines. It's easy to administer the parenteral nutrition on such a device.
What is your position on supplemental parenteral nutrition as a strategy to reach protein and caloric targets?
So just remind that in the pancreatic cancer, we have many data suggesting that malnutrition is very frequent in the pancreatic disease. But we also know that, for example, with the publication of Marie Rivelsford, that 61% of patients with pancreatic cancer are at risk of malnutrition, with an increase of the overall mortality with an hazard ratio at 1.67. So it is really important to be able to diagnose malnutrition, to be able to assess the needs of the patient, and to manage them correctly in order to limit the impact in terms of survival. So thank you very much for your attendance. Thanks for hearing me. Please attend the excellent data that we will have on malnutrition during the MASCC, the different MASCC meetings and with the study groups. And thanks to Baxter for his confidence on this video. Thank you very much.